All right, today we're going to decode the secret language that doctors use to, well, navigate the incredible landscape inside our own bodies. This is the absolute key to understanding pretty much every modern medical scan you can think of, from CTs to MRIs.
I mean, it's a question we've all wondered, right? You see those super detailed black and white images from a hospital, and you just think, how on earth is that possible? How can they find one tiny little detail in this sea of complex organs and tissues? Well, I can tell you it's not magic. It's a map. And that map, it's called sectional anatomy. Think of it as the art and science of seeing the body not as a whole thing, but in these distinct individual slices or planes. Mastering this is what turns a confusing jumble of a scan into a crystal clear diagnosis. It's really the foundation for everything else we're about to look at. Okay, so let's dive right in. Before we can take our tour through the body, we've got to understand the rules of the map. And it turns out there are 3 essential ways to slice the body to get a clear view. We call these the anatomical planes. So the key here is just getting your head around 3 ways of looking at the body. First, you've got the sagittal plane, which divides us into left and right. Then there's the coronal plane, which creates a front and back view. A really easy way to remember this one is to think of where a crown, or corona, sits on your head. And finally, the transversal or axial plane. This is the one most of us picture, those top-to-bottom cross-sections, kind of like slicing a loaf of bread. Literally every single medical scan is built on these 3 essential views. So, now that we have our map, let's actually put it to use. We're going to take a quick trip from head to toe and see exactly what these different planes can show us.
And we're going to start right at the top, in the body's super delicate command center, the head and neck.
You know, using these planes, a doctor can digitally slice through the brain to check out everything from the frontal lobes, which is where we do our planning, to the cerebellum, which controls our balance. They can see if the trachea is clear or if the salivary glands are swollen, all by looking at it from these different totally crucial angles.
Okay, moving down a bit, we enter the thorax. This is basically the protective cage for our heart and our lungs.
Now, this is where these sectional views are just absolutely critical. A coronal slice, for instance, can show all 4 chambers of the heart at once, while an axial view is perfect for inspecting those huge vessels, like the aorta. It even lets doctors look at the very tissue of the lungs, the parenchyma, to spot signs of pneumonia or other diseases. It's just incredible. Deeper still, we find ourselves in the abdomen and pelvis, which is a region that is just jam-packed with vital organs. Yeah, the coronal and axial views are the real superstars down here. They create this perfectly clear roadmap of the liver, the kidneys, the intestines, which is just indispensable for spotting tumors or planning really complex procedures. Think about it. A doctor can map out the exact location of the prostate or the uterus before surgery even begins. And finally, this exact same technique gives us an incredibly detailed look at our limbs. For an orthopedic surgeon, right? Being able to see a cross-section of a knee joint, and I mean visualizing not just the bone, but every single muscle and ligament, that is the difference between a good repair and a great one. It's a complete 3D understanding of how we move.
So, okay, we've seen the what, the planes, the body parts, but what about the so what? How does all this knowledge actually translate into saving lives and improving people's health?
This is where it all comes together. See, sectional anatomy isn't just some academic thing. It is the critical path from diagnosis all the way to treatment. It lets a radiologist spot a problem on a scan, it helps an oncologist understand its exact size and shape, and it allows a surgeon to plan every single move of an operation before they even make an incision.
Honestly, when you really step back and think about it, this ability to non-invasively see inside the human body with such incredible precision, it's got to be one of modern medicine's greatest achievements. At the end of the day, this isn't just about identifying structures. It's about identifying problems, pathologies, and then being able to track how well treatments are working. It's really all about turning images into insights, and then turning those insights into better outcomes for patients. Which, leaves us with this really fascinating question for the future. We've pretty much mastered the slice, the static image. But as technology just keeps marching forward, what's next? Are we talking about real-time functional imaging, being able to see down to the cellular level? What's going to be the next great leap in how we see ourselves?